Welcome back. Our next session is going to look at a trend that has only exploded during the COVID-19 pandemic. It's the rise of the empowered patient and what it means for healthcare communications. I'd like to hand over to someone who's going to both lead and moderate this session, Weber Shandwick Healthcare EVP, Wincy Chan. Wincy, over to you.
Thanks, Arun, for your introduction. I think the mic is working, right? Okay. Good afternoon and welcome to everyone here and also online for the Weber Shandwick Healthcare panel discussion. We're at the Provoke Asia Pacific Summit in the Soho House in Hong Kong. It's very nice to be here in the room with people today. I haven't been to a physical event for such a long time, so I'm sure it's pretty much the same with a lot of you here. We do have a very interesting topic for discussion today. The theme is patient empowerment. And I really do think this topic is really has emerged on the horizon as a new paradigm. Nowadays, we see more patients playing more of an active role in terms of making decisions around their treatment choices and also their own disease management plan based on the newfound knowledge, either through the internet or other sources. And also, since the pandemic, we see people are more capable in researching for difficult topics such as the pros and cons of vaccines. We see people actually asking for COVID-19 vaccines by names. And personally, I find it very strange and weird that I hear my friends and family talking about pharma brands such as AstraZeneca, Pfizer, or Sinovac. I think, definitely everyone is trying to become a health expert. With this, I think there's definitely a greater awareness of the healthcare brands and also greater awareness around the general healthcare knowledge. So with this, patients are more empowered. The question really is, does this really optimize health outcomes, or is this a recipe for confusion or conflict? So let me introduce you to our wonderful panelists first. First online, we have Rachel from Singapore. She's dialing from Singapore. Rachel is head of communications from Boehringer Ingelheim, and she looks after the regional operating units of Southeast Asia and South Korea. Welcome, Rachel. You can hear us, right? Excellent.
Yeah, no worries.
Excellent. And right next to me is Kylie Park. Kylie is the Director of Corporate Affairs and Advocacy Relations from Amgen, and she looks after the Japan and Asia Pacific region. And finally, we have Andrew Chitje. Andrew is the Chief Executive of AIDS Concern based in Hong Kong. So actually, I forgot the housekeeping. So if you have any questions, do feel free to submit the question throughout our panel discussion. I think this really leads me to the first question for the panelists. Do you think patients in our region are becoming increasingly empowered? And what is really causing this transformation? Perhaps we can hear this from Andrew first, giving us the patient group's perspective.
Thank you, and thanks for putting on this excellent event. I think the opportunity for patient empowerment is bigger than it's ever been before. I think the question is, how do we make the most of it? So access to information is like it's never been before. We've seen a quantum leap in terms of healthcare information that's available, and many organizations now opening up access to all sorts of clinical information and studies. The issue is, can people really understand what they're finding, and are they finding the right sort of information that helps them in their healthcare decisions? I think patients aren't looking for doctors and medical professionals to completely hand over decision making to them. I think people are often wanting doctors and specialists to say, here is what the evidence is showing, and here is some of the advice I would give. But I think certainly patients are becoming much more informed, and especially when there are new innovations, often they're the first to come to NGOs or doctors and say, I've heard about this, can I get it?
Thanks, Andrew. I think I can't agree more to the point that the importance of patient accessing, credible information and really not relying to Dr. Google all the time, right? And I think I must confess that I do use Dr. Google sometimes. So Kylie, what is your perspective, and what do you think is causing this transformation?
Yeah, I think it's helpful to look at this from the perspective of what's happened recently with regards to COVID, but then more generally, certainly in the last 18 months or so, the opportunity for patients to become empowered through access to the internet, digital platforms, a rise in virtual events, just like this one that we have today, in many ways has really opened things up for patients to be able to access that information. Certainly from our own perspective, previously, that would have involved having to have patients travel or require transportation to access some of these educative events, and now in many ways it's much easier for them to access the information. So certainly I think that is one thing that perhaps COVID has done is sort of opened all of us up to the opportunity afforded by virtual and digital platforms. And then I think more broadly, we have to look at things like wearable technologies, the rise in wearable technologies and the opportunities for all of us to at least keep a watching brief on our health and what's happening with our bodies has been really empowering for patients. And then I think to Andrew's point, just the sheer volume and speed at which innovation is coming down the line has really required patients and patient groups in many ways to sort of move beyond that sort of support and caregiver role to the much more kind of advocacy type role where they're actively looking and seeking out information about treatments and innovations and then being able to advocate on behalf of their constituents.
Thanks, Kylie. I definitely do agree to your point around how the pandemic has really speed up or accelerated the speed of the innovation, and also, the availabilities of the wearable technologies really do require patients, to be more empowered. And I think, from the agency point of view, we also see that pharma companies are nowadays more open to patient engagement and really see that benefits of co-creation. And that's very interesting views from both of you. And over to you, Rachel. Can patients be too empowered?
I don't think patients can be too empowered, but I think they're overwhelmed. So I think the amount of information that patients do find online and do find on their own can be very overwhelming, and they can get pretty confused, or they just don't know where to start. And so I think there's nothing wrong with patients being empowered to ask questions, to be interested in their own treatment options, to ask questions, to understand disease conditions. But I do think that it's pretty hard to sift through all the stuff that they have available to them and to make sense of everything. So that is a challenge.
Thanks, Rachel. And Andrew, do you have anything to add to this?
I think that it's a challenge, but it's a very big opportunity. The populations around the world are living longer. People living into their 80s and 90s, living with many long-term conditions. We can't expect health systems to be able to do everything. And if we really want people to have good health and well-being, we need people to be looking after their own health, not always expecting that that's going to be what they go to the doctor or the clinic for. So we need to find ways to help people look after their health. I agree with Kylie. Technology is one of the really big ways that we can do this. And I think there's been a quantum leap, really, in people's interest and ability to make use of new technology. We're using technology in many parts of our lives, and this can be a benefit in the healthcare arena because people are very used to it. I think there's often a view this is just about younger generations, and it's really not anymore. So I think opportunities for online consultation. AIDS Concern, we've been rolling out HIV self-testing, and that's been growing, where people actually test themselves using good technology with information and support, so they don't always have to come to a clinic. COVID forced that to happen partly and brought it along quicker, but it's also part of a trend.
Thanks, Andrew. I tend to agree with the fact that patient can never be too empowered. I think as long as they are equipped with the skills to really look for the latest credible information, researching for the condition, and also have the skills to really ask the right questions to the healthcare professional and expert. Talking about healthcare professionals, we see a lot of webinar engagement direct to doctors. So I have a question for Rachel online. Do you think empowered patients are now more open to receiving information from the doctors and also from pharma companies through webinars?
Yeah, I do think so. And I can see that upward trend, obviously kind of spurred by the current pandemic, where people are looking for information, but they can't step out. So then having information, sort of very conveniently come to their inbox, come to their screens, come to their social media channels where they can sign up for either a free Zoom webinar to understand disease conditions. I did that myself. Or to, really ask questions, but actually also in a sort of a safe environment, because a lot of these webinars allow a lot of patients to ask questions anonymously. That has really empowered the patient. And I do believe that they're open to it. And I think doctors and the pharma industry are open to it too, because they see an opportunity to actually sort of dispel some misconceptions, to provide information directly, to give scientific-based information. And I think it's a win-win for both sides.
Thanks, Rachel. I think that we definitely see more patient-centric initiatives around in our region, and I think I guess we do need to be mindful that in some countries there may be restrictions around direct to patient engagement through social media channels. Back to Andrew, a question for you. From the patient point of view on the role of efficacy in empowerment, why do you think patients get involved with efficacy, both on an individual patient level and also on a community level?
I think some patients want to get involved on a community level. I think particularly when people have a long-term condition, which they're able to manage, and they can see the benefits of peer support that they've had from other people in the community. That people often feel a real sense that this is a big part of my life, and I want to help other people who are having to handle this, going through it as well. But that's not always true, because when there's a very stigmatized medical condition, I mean, HIV is an example. You can talk about many types of sexually transmitted infections or mental health conditions. Actually, people are really afraid to reveal that they have these medical conditions, and they don't want to be part of public advocacy. But they are able to be part of individual advocacy, talking to their doctor and the medical system and asking good questions. I mean, often when there are new treatments coming out for particular medical conditions and people have heard about them, they will now go to the doctor and say, oh, I've read about this, which is different to my drug regimen. Would you recommend it? It says it has fewer side effects than the current regimens. What do you think? So I think there are different ways for people to be able to get involved in advocacy.
Thanks, Andrew. I also think that in terms of the patient group level of involvement, also very much depends on the kind of the therapeutic area of the patient group. As you say, we see that HIV patient groups in the region are generally more sophisticated, whereas when you see other patient groups, maybe for other disease such as arthritis, for example, they tend to be more grassroots, and their remit is very much focused on patient exchange or support, organizing leisure activities such as eating mooncake together or hot pot together or hiking. And but when it comes to government lobbying or advocating for change, they may not have the capability or capacity to do so, which I think there's an opportunity to upskill them. And then I think on an individual patient level, I think nowadays we do see more, it's easier to find patients to come out and share their stories in front of media or in front of the general public. But obviously, it depends on the condition. As you say, stigma is, some patients have a lot of stigma that's attached to the condition. So talking about stigma, that really leads me to the next question for you, Andrew. As you said earlier, there's a high level of stigma among people living with HIV. So how much does stigma really counter the efforts to empower patients?
It has an enormous impact. It's probably the single thing that has the most impact in preventing development of good health for people living with HIV and people with lots of other stigmatized medical conditions. I mean, if you feel uncomfortable in yourself about the medical condition that you've got, you might be embarrassed or ashamed or afraid to talk to others, then you're not going to seek out information and help very easily. And you're going to often feel uncomfortable accepting that sort of information and help from other people. So that's part of the nature of those medical conditions. But we can challenge that stigmatization. Of course, there's making sure that medical services and the sorts of information and education campaigns that we run are destigmatized, but also very welcoming and warm to people. But I think also we can make sure that we provide options to people. You know, when people come to my HIV testing center here in Hong Kong, very often they don't get out in the lift on the floor where we are because they're embarrassed. People will see them getting out of the lift. They'll go up the stairs to a different floor and then come down and move around. That's the way it is. But I think we provided people with options like anonymous booking systems, HIV self-testing for them if they want to. They can go to a vending machine, they can buy online, they can buy from a store with cash. Lots of different ways that can help people. So I think this is part of what we need to think how, yes, we can try and challenge stigma, but this is a really long-term issue. So I think we need to find ways to help people access healthcare.
I agree. Thanks, Andrew. I think definitely more to be done around the community education and really debunk that misconception, right? And how we can help to really empower patients to overcome stigma. I think that's very important. We talked earlier about the internet and technology contributing to empowering patients. A possible downside of this is that elderly people or underprivileged may not have the ability to access technology or internet. So from your perspective, what is the best approach to ensure that we don't leave any patients behind? So perhaps Kylie, you can go first.
Sure. Well, first of all, I think we should, as you know, I think we've spoken about previously, we shouldn't assume that just because people are older or of a certain background that they're not accessing digital and online platforms. I think the evidence would suggest otherwise, but certainly I think this is where we as communicators need to come back to first principles. Who is our audience? How are they receiving information? How do they like to receive information? What works for them? And I think also importantly, from our perspective, what is relevant for their caregivers. Often, the caregiver plays a really important role, so we need to think about that as well. I think it's really about listening to how they're receiving information, making sure that there are different options. And I think what we've seen with, in the last couple of years is that often these virtual platforms and digital platforms have, as I said at the outset, they've actually opened up accessibility to information because people aren't necessarily having to travel so far to receive that information. And in addition, the caregiver can be there in the home, talking to the doctor, through via telehealth or one of the other platforms. So I think it is really about, in one of the other sessions we talked about outside in, really listening to how people need to receive information and what works for them, and not making generalizations, based on someone's background.
Thanks, Kylie. And Rachel, would you like to share your thoughts?
I think if it's any program that communicators might be running on, let's say, the digital or the social media space, to Kylie's point, consider the role of the caregiver as well, because the caregivers are probably at a younger demographic who are used to using these social media and digital platforms. They're sort of your gateway to making sure that you are reaching that target audience. And I think it's also the fact that healthcare in general is sort of involves more than just the patient. The patient's at the center, but they have caregivers, they have the community around them. And I think there's a role to play in making sure that any communication campaign, any initiatives that we run actually also involve all of these components. And they all have a role to play in order to ensure that information can be accessed easily. That would be my contribution.
Thanks, Rachel. I do think that caregivers are, a very important channel. And also, we also need to be flexible to really go back to the traditional route as well, such as booking for televisions or radio, right? To really reach this group of target audience. Andrew, what is your perspective around this? As we know, there's an increasing aging population among people living with HIV.
I think that, look, lots of people are using technology, and I think many parts of Asia, people are using QR codes now to buy fruit from the market stall. It's this technology is just becoming commonplace for everyone to use. But this is not true for everybody, and not everybody is comfortable using it. I mean, how many of us constantly have to press the forgotten my password button, right? I mean, all the time, every day. And this is part of the challenge. And if you just think about the range of comorbidities that people get as they get older, I used to work in dementia and Alzheimer's disease. And if you think about the number of people living with dementia, which is growing as the population ages, the question would be, how can we make sure that technologies and interventions work for people who can't always operate as systems and technology require them to? Yes, you can have reminder systems, of course, but there is still a role for the human in providing information and support to people. And back to Rachel's point about families. So I think let's not just rush headlong into doing everything in the most technologically sophisticated way we can without recognizing the larger group of people that still exists who need other options too.
I was just going to add to that. I think it's also about, when you're talking about elderly populations, it's also about what feels credible to them. Where do they traditionally feel that credible information is coming from? And I think this is where we come back to the healthcare practitioner. I know my own parents, if it's said by their local GP, it is gospel. It doesn't matter how many clinical papers I find for them and can highlight. It doesn't matter if their GP has not said it, then, they're not doing it. And I think that's really important. That relationship between the healthcare provider and the patient will continue to be really very important. So, for example, as we continue to go through COVID, the more we can have sort of healthcare professionals providing that reassurance, particularly to that population, could potentially be, has been, and I think could potentially continue to be very effective as they communicate information around, vaccines and so forth in particular.
Thanks, Kylie. So my next question is really, how do we keep patients engaged and empowered from the point of diagnosis, right? So we're talking about like chronic diseases such as like osteoporosis or heart disease, diabetes. Very often they, it really require patients to be engaged and adherent for life. So, how can we keep these patients engaged? Perhaps I think Rachel has a COPD initiative that you want to share.
Sure. So, I mean, one of the things that Boehringer Ingelheim actually created to exactly help with that, with patient engagement, or rather the patient journey from the point of diagnosis all the way to disease management, was kind of something that Andrew had mentioned, which is QR code, something as simple as that. So in one of our inhalers for COPD, in Singapore specifically, and it was also something that the Singapore government was really looking at to try to shift to a more sort of modern city, and some of the goals that they had given to us was also to consider innovating our products. On that pack, QR code for someone to scan, and you pop out a video. So actually there is a pop-up video tutorial that actually helps patients to actually understand how to use the inhaler, because it can be quite tricky for someone who's not used to it. There are different components to kind of set it up and to press the button. And I think sometimes when it comes to patient adherence, it drops off when it comes to patient treatment, because they might get frustrated about trying to understand their treatment and how to manage it in the long term. They might feel frustrated because they don't want to rely on someone else. They want to do it themselves, but they don't know how to do it, and they don't want to, sort of trouble the doctor by trying to, I have to go back to the clinic now to go and ask the doctor, how do I do this again? And then they forget when they get home. But now something as simple as using their mobile phone, using their camera phone, scanning a QR code on the pack and having a video to be able to play every single time. They just need a reminder. How do I do this again? That really helps all the way in that patient journey. And I think that's something that BI innovated recently for Singapore. And we hope, obviously, that it will roll out to more countries.
Thanks, Rachel. That's very interesting. And Kylie, do you have anything to share?
Yeah, I think, again, it comes back to relevance. So, one of the programs we ran in Australia last year was more of a sort of a public service initiative around ensuring that, during the pandemic, particularly older people were not forgetting about their bone health, because, of course, if an older person falls over and breaks their hip, it can be absolutely debilitating and can have a massive impact on not only their own life, often leading to, early entry into elder care facilities and so forth, but the downstream impact on the family is significant. So one of the initiatives that we looked at was, some sort of public service awareness messaging around ensuring that people were continuing to look after their bone health. And in fact, we used a combination of sort of traditional media, a radio in particular, during that campaign, which I thought I was the only one that still loved radio, but clearly, this is still a very effective medium for certain sections of the population. So again, I think it comes back to relevance. And making sure that, that particularly we as pharma companies are not just coming up with ideas. I think someone said in the last session and, putting our hand up and thinking that this is good, but actually genuinely listening, and then perhaps partnering with others to deliver those messages, or work with those who are best placed and have the credibility and the contact to deliver those messages to the patients themselves.
Thanks, Kylie. I do listen to radio still every morning. And Andrew, do you have anything to add?
I think we need to help people integrate good health into their lives, and that's not always easy to do. But I think, apart from things like video tutorials and top tips and mainstreaming some of these health interventions, I think there are an amazing range now of online support groups and networks that people can be part of. So the old model might be that you go to some village hall and meet with other people who are going through the same thing and chat once a month. There's still a role for that. But I think now, I'm a member of loads of online groups, and there are all sorts of things that pop up every day, some of which I read, and where people are talking about everyday challenges. I mean, as a parent, I'm a member of lots of them, and they talk about how to handle your toddler who is having a tantrum and how you shouldn't just lose your temper and how you handle it. There are lots of these types of groups for people with long-term medical conditions, and I think we need to start developing this sort of support infrastructure. Now, can be a lot of rubbish that's spoken in these groups, and I think it's important for them to be supervised and to have people who are able to chime in and say, well, that's not quite right, because there's often conflicting information. But nevertheless, alerting people to types of things that they can do and support that's available is something that can happen through online networks as well, I think.
Thanks, Andrew. I think it's going back to the important points around, patient accessing the credible information, but it also needs to be engaging and compelling. And I think overall collaboration with doctors is also very important. So finally, last question before we go to Q&A. We are living in the era of fake news, where social media is king. How can we help to uphold the standards and responsibilities of all media to their audience? Perhaps we can hear from Kylie first, as you're a former journalist, and what is your view around this?
Reminding friends and family about the importance of good sources, and, to be honest, reminding our own employees. I think the interesting thing as a science-based company has been sort of to watch some of the fear and the angst even within our own organization over the last year and a half, as we've all experienced COVID. And I think that, we all know where to find good information and what good referencing looks like and credible sources. But when we are experiencing it live, some of that, will often go out the window. And so I think, it really is just about, at the very personal level, wherever possible, reminding our employees, reminding our colleagues, reminding our friends and family about what good looks like, and reminding our children as well, because I think, they probably have more influence than we sometimes give them credit for. And so that's a really important a really important thing to do. I think that in general, again, for companies like ours, we are so used to, and we sort of live and die by referencing and sourcing and peer reviewed journals and so forth. So for us, there's perhaps a role going forward in terms of helping to corral and curate some of that information, and then partner with others to make that perhaps a little more accessible to a lay population.
Thanks, Kylie. I think we do have to stop here for Q&A. Any questions from the floor here for our wonderful panelists? There's a question over there.
Just to follow on from Kylie's answer just then, I'm just wondering, do you think there needs to be a bit more responsibility or accountability for some of the social media platforms and how that, I guess, misinformation is rolling out, especially, in light of a pandemic right now?
Yeah, I do think that's a really interesting observation. And even from a personal perspective, I've been watching just some of my personal feed and I live here in Hong Kong, but obviously I'm an Australian, and seeing some of these some of these messages and so forth coming through, and sort of observing that, and then going back and seeing that some of those have actually been removed or obviously checked, by some of those platforms. So, I do think that there is a level of accountability, particularly in this sort of era, to ensure that information is credible. And that's not by any means limiting choice, but it's basic fact checking, right? It's those basic principles that we all grew up on as young journalists or, young communicators. You need to be able to, or you have a responsibility to be able to reference or source that information. So, I do think it's an interesting observation. It will be interesting to see how that goes, but certainly just as a lay observation, it seems to be that some of those platforms now are almost self-checking, if you like, checking both formally, but then some of the comments are in and of themselves helping to check that information. So I hope that continues. I hope that's answered your question.
And any final thoughts from Andrew and Rachel before we close?
I think that panic can spread around the world at the touch of a button before scientists and researchers have even sat down for their breakfast in the morning, And I think this means we do need a very different way of operating health education. Health education is no longer just what happens in the doctor's consultation room. People find out all sorts of information and are wanting to make use of it to improve their lives and their families' lives. So we need to see doctors and governments stepping up, actually, and getting out front to explain what's fact and what's not, and not taking a long time to do it. So I think that's part of the solution.
Thanks, Andrew. I think we do have to stop. Arun is looking at me, so I'm going to wrap up. So thanks very much, everyone. And I think it's a great opportunity to hear the different views across the spectrum from the patient group and also from the industry's perspective. I think this, what we talked about is a really great positive start in terms of what we can do further. To continue to empower patients in our region in the right direction. So on behalf of Weber Shandwick, I'd like to thank our wonderful panelists, and I'd like to thank the audience online and here in Soho House, and also thank Provoke Media for organizing this event for us. Thank you.
Hi guys, take care.
Thank you. Thank you, Rachel, as well on screen. Thank you, everyone. It's been really interesting session about a trend I think that will only become more and more important.